And now I would like to introduce our speaker for our keynote address, Dr. Jonathan Patz. Dr. Jonathan Patz is director of the Global Health Institute at the University of Wisconsin-Madison. He is a professor and the John P. Holton Chair in Health and the Environment with appointments in the Nelson Institute for Environmental Studies and the Department of Population Health Sciences. For 15 years, Dr. Patz served as a lead author for the United Nations Intergovernmental Panel on Climate Change, or IPCC, the organization that shared the 2007 Nobel Peace Prize with Al Gore. He also co-chaired the Health Expert Panel of the United States National Assessment on Climate Change, a report mandated by the United States Congress. Dr. Patz is committed to connecting colleagues from across campus and communities around the world to improve health for all, and is continually striving to integrate his research into teaching for students and communication to policymakers and the general public. Dr. Patz has written over 90 peer-reviewed scientific papers, a textbook addressing the health effects of global environmental change, and he has co-edited the 5-volume Encyclopedia of Environmental Health. He most recently co-edited Climate Change in Public Health and is leading a massive open online course, Climate Change Policy and Public Health. He has been invited to brief both houses of Congress and has served on several scientific committees of the National Academy of Sciences. Dr. Patz served as the founding president of the International Association for Ecology and Health. In addition to directing the university-wide Global Health Institute, Dr. Patz has faculty appointments in the Nelson Institute Center for Sustainability and the Global Environment, and the Department of Population Health Sciences. He also directs the National Science Foundation-sponsored Certificate on Humans in the Global Environment. And most recently, he was inducted as a member of the National Academy of Medicine just last month. He is double board certified, earning medical boards in both occupational environmental medicine and family medicine, and received his medical degree from Case Western Reserve University and his Master of Public Health degree from Johns Hopkins University. I encourage you all to watch his TED Talk. The link is there. And without further ado, Dr. Patz.
Hello. Today I'm going to talk about why the climate crisis is a health emergency and why solving the climate change problem is a golden opportunity for Africa. Now, it's not your imagination that the Earth is getting warmer. If you look at average summer temperatures, these are statistics from the Northern Hemisphere. Notice the average temperature from 1951 to 1980, 83 to 93, and notice the very extreme temperatures, the red color on the right, 94 to 2004 and 2005 to 2015. It's not your imagination. Things are really warming up. Now, according to the Intergovernmental Panel on Climate Change, the projection is for continued warming. On the left is the optimistic scenario of a representative concentration of greenhouse gas emissions that only heat the planet 2.6 degrees centigrade per cubic meter. But business as usual, the way we're burning fossil fuels now, this is what we're heading for. This is 8.5, RCP 8.5, and that's warming up to 7 degrees centigrade as a global average. That's quite extensive. These estimates are that Africa could warm anywhere from 1 to 5 degrees centigrade by the end of the century. Now, zooming in on the African continent, if you look at by mid-century forecasts, the northern and southern regions of Africa will warm the most. So anywhere from 2 to 3 degrees centigrade in the summertime, and Central Africa will warm up a little bit less. Precipitation is harder to predict, but the IPCC is estimating in general that wet areas will get wetter, dry areas will get drier, And this has all sorts of implications, especially for agriculture. This is looking at temperature trends in Ethiopia increasing. And the question that we all have in the health profession is, well, what does this warming mean for our health? And this is pretty well established. We've been studying this for more than 20 years. We all know how many climate sensitive diseases there are. And climate change, which will bring not only rising temperatures, but sea level rise and extremes of the water cycle, more droughts, floods, and fires, has all sorts of implications across these health pathways and all of these different health outcomes and climate sensitive diseases. It's one reason why I've dedicated my career to studying this problem, which I view as the largest environmental public health challenge of our times. Now, some direct implications from heat. We all know that people die in heat waves. Worker health is at risk. And as you look at this chart here, this is looking at labor capacity compared to the wet bulb globe temperature. Wet bulb globe temperature is used in occupational settings. It combines temperature, humidity, solar radiance, and wind speed. And of course, worker capacity goes way down as you increase that index. So it's a risk to workers. It's also a risk to labor capacity. This is a projection looking at different parts of the world, comparing 1975 to 2030 as far as labor capacity. This is the African continent, and primarily Western Africa may be quite hot and problems with worker health and worker productivity. Now, of course, when we think about climate change, we think about those hot temperatures, and this is a map, projections for mid and also late century. Late century is on the bottom. Every area marked in red has a 90% probability or greater of having a record-breaking hot summer temperature. And this is modeled from NOAA, the National Oceanic and Atmospheric Administration. And this is, that could be problematic for growing crops. Going outside of the safe envelope for growing crops, you can be too cold or too hot. And so the estimates are that we could see a doubling in the number of people at risk for hunger by mid-century. That's striking. And of course, you can see the African region. Africa lights up as at risk. From the Intergovernmental Panel on Climate Change, these are some estimates for crop yields going down. This would be quite a problem for public health generally. Now, thinking about infectious diseases, malaria, of course, transmitted by mosquitoes, which are cold-blooded, which means whatever the air temperature is, that's their body temperature. So if a mosquito is carrying the malaria parasite, you can see that as the temperature increases on the y-axis, the number of days that it takes the malaria parasite to develop gets shorter and shorter. And so mosquitoes are more infectious more quickly, and climate really drives dynamics in malaria transmission. In a place like Zimbabwe that has marked topography, notice that at the high altitude areas, which of course are colder, we see very little malaria transmission, prevalence and incidence of malaria. And if you compare climate suitability maps for malaria, notice these cool colors, the greens and the blues, right along the high plateau in Zimbabwe. And as you drop down in elevation, much more suitability for malaria in either direction here. So high plateau, colder temperatures, less climate suitability. But let's roll forward a few years. By 2050, it will be warm enough that all the highlands will be more prone for stable malaria transmission. The other thing to remember, of course, is climate change is not just temperatures, extremes of the water cycle. And this is modeled precipitation change for the Blue Nile Basin. This comes from Paul Block, a colleague of mine, a hydrologist. And notice how, how wide this becomes, real flashy, flooding and drought. The water cycle could be quite devastating for parts of Africa. So one concern that we have right now with the COVID pandemic is that will people fear the trade-offs of solving yet another global crisis? And the climate crisis, I view as even larger than the current coronavirus pandemic. So will anyone respond when we're faced with another crisis? Well, unlike COVID, I think that fighting climate change could be free or even a net benefit. And I've been publishing about, climate change challenges and opportunities. Solving the global climate crisis could be the greatest health opportunity of our times. A low carbon future could improve global health and achieve economic benefits. And the evidence is obvious. I mean, look at the energy sector. Air pollution kills 7 million people every year. Look at the food sector. An energy intensive diet, especially meat and dairy, leads to 11 million premature deaths every year. This is different though for Africa. Livestock in Africa is a good thing. Plenty of regions in Africa that, the land is not suitable for growing crops. So I think this is an average global benefit of 11 million premature deaths, probably a bit different for Africa. I think Africa is more of a crop yield issue. So this is global. The other is transportation. Because of the over-reliance of automobiles and sedentary lifestyle, there are estimates of more than 5 million people that die prematurely from sedentary lifestyles. So let's take a look at the first one, air pollution. There are issues with outdoor air pollution, ambient air pollution in cities, but also indoor air pollution, which kills upwards of over 3.5 million people every year. This is a picture I took in an injera kitchen in Bahir Dar, Ethiopia. Those white beams are not beams from heaven. That's sunlight showing just how much particulates are in that room where this woman is baking injera bread. So right now, the COVID pandemic has caused us to reduce our emissions of fossil fuels. We've shut down the global economy. And what have we seen as far as air pollution during COVID? Look at these satellite images from China, looking at nitrogen dioxide, which is detected by satellite. On the left, you see an image from January of this year, and then China shut down its industry. And 1 month later, look at the air quality over China. Same thing for Europe. This is a satellite image of nitrogen dioxide over France and parts of Germany. Last March versus this March, much cleaner. Same story in the United States. The upper map is March of last year, the lower map is March of this year. And who would have ever imagined that these mega cities in India would see a green, clean air index in their cities? People have already started doing modeling studies of estimating what would this air quality benefit be by shutting down fossil fuels. And this just came out looking at China and Europe, that 2 months of clean air from shutting down fossil fuels already in China has saved more than 24,000 lives. In Europe, over a 3-month period, 2,000 lives saved. So we know that air pollution kills, but the COVID pandemic is giving us a natural experiment just to show how much is at stake if we continue to burn fossil fuels and let people die from air pollution. And what could be any clearer than a picture like this from New Delhi, India? On the left, that soup of air pollution before COVID and after the COVID shutdown. You can see clear air. What could be any clearer than comparing today's air quality compared to business as usual and the millions of deaths from air pollution? So at this time, I ask this question: do we really want to uncork the current fossil fuel economy, or get to a clean energy economy where everyone prospers? We've run some experiments locally. We had a very bright graduate student ask the question: what would, if our state of Wisconsin, here up in the upper Midwest in North America, what if we could generate our electric power only in state and not rely on coal burning power plants outside of our state? If we used in-state power, and mostly from clean energy, most of this is from wind and solar, conservation. We kept nuclear, it's 4%. But a pretty clean energy scenario, what would that mean for health? Well, this is a map of our state where Giannis and Caitlin also live, my colleagues that are part of your meeting, emergency medicine physicians. So if we got to this clean energy scenario, we would save almost 2,000 lives every year and avoid all these other hospitalizations and problems, these health problems. And if you were to combine the health benefit from a reduction of fine particles, PM 2.5, and ozone, we would see a health benefit from reduced mortality and hospitalizations that equate to $21 billion every year from reduced air pollution. We'd also see an increase in jobs, a net increase of 162,000 jobs. So, that's a political story about jobs, but we know that jobs equate to health, and the renewable energy sector has enormous job growth possibilities. Now, there's the argument of what does it cost to invest in clean energy? It may be upward of $30 to avoid 1 ton of CO2 emissions. But when you burn coal and oil and you emit greenhouse gases like CO2, you also emit harmful pollutants like fine particles, PM 2.5. So for every ton of CO2 that we would avoid emitting, we would also have a reduction in those other pollutants, so much so that the health benefit in reduced mortality and morbidity would be on average $200 for every ton of CO2 avoided. And I would ask the decision makers to really look at this, at which number is bigger, when most of them are only focused on the investment costs of cleaner technology versus the health benefit. And of course, in places like in Southeast Asia and polluted places, the health benefit is far greater. And with recent studies, this question of $30 is still, it's actually quite questionable. It may be a lot less. Look at the price of solar energy. It's dropped 99% since the 1970s. And for the first time in history, if you remove all subsidies from energy sources, renewables plus batteries have become the cheapest way to generate electricity, according to the International Renewable Energy Agency report. So this is the first time. This is something, there's no need to wait. We really need to get to clean energy and save lives while we do it. Quickly, another sector, the food sector. This is a big commission report that came out of the journal, The Lancet. This is called the Eat Lancet Commission Report. And bottom line is that if you were to take what they propose as a universal healthy reference diet, which is a diet that we all know is quite healthy, more fruits and vegetables, and no or low quantity of red meat, processed meat, added sugars, and starchy vegetables. That would have a huge health benefit. And this graph is showing everything in this shaded area is in excess of, on a global average, way too much meat and dairy and starchy vegetables in our diet. If we could get to this level and get to a reference, their healthy reference diet, that would save lives. Again, this is a different story for Africa compared to the world as a whole, but this is looking at global averages. And I won't dive into this that much, except to say that these different categories of food, from meat down to these legumes and vegetables, have an environmental impact as far as carbon, greenhouse gas emissions, land use that is used to grow meat, for example, cattle ranches, energy use, acidification, and eutrophication from fertilizer use. And I know that in Lake Tana in Africa, in Ethiopia, tremendous problems with the the fertilizer runoff into Lake Tana that is just causing all sorts of trouble. So if we were to get to their universal reference diet, the scenario is that we could save 11 million lives every year across the world. Again, important, but in Africa, I think that the key thing with climate change is the crop failures. So take these two together in this sector. The last sector I want to just mention is transportation. I'm only going to give statistics from the United States, I'm sorry, but what I can tell you is that if you look at cities with the highest rates of walking and cycling, what we call active transportation, we see obesity rates that are 20% lower and diabetes rates 23% lower compared to the worst cities that have the least walking and cycling. And of course, exercise reduces the risk of heart disease, cancer, dementia, and depression. In Africa, of course, the idea is to promote physical fitness, but I think a bigger problem in Africa is road safety, and fatalities and injuries from roadway accidents is just enormous in many parts of Africa. So look at these opportunities for active travel in promoting physical fitness, but to seize those opportunities, the different modes of travel have got to be safe. So there needs to be concerted effort from emergency medicine doctors and the entire health community to meet with urban planners and transportation planners and promote safe modes of travel, equitable travel from every way of from walking to biking to mass transit and others. So very important. And of course, the other half of transportation is air pollution. Diesel exhaust is the most dangerous of all the emissions from travel. And so this is something that needs to be really looked at. And this is where African cities really matter when you think about their trend and how we are, living in a more urbanized world, and the rates of urbanization in Africa are especially dramatic. This is looking at population growth in Ethiopia. Right now, Ethiopia is only 17% urbanized, but just in a few decades, that number will double. And so as we think about African cities increasing in size, and it's mostly the medium-sized cities that are going to be exploding in population. So the mega cities are going to be growing, but growing at a slower rate. It's these cities that are medium-sized city and small cities that are going to be growing a lot. And there are estimates that by the end of the century, there will be more people living in cities that haven't even been built yet compared to cities right now that exist. So golden opportunity to plan with this massive urban expansion to plan cities that are planned for people and not just for motorized vehicles, so that they are walkable, bikeable in a safe way, they are clean without pollution. And so golden opportunity, especially in Africa. And when you look at urbanization and air pollution emissions, you can see that the more urbanized a city, a country becomes, that, there's this idea of per person greenhouse gas emissions and pollution. So you can have a city, look in South Africa, that's modeling after the industrialized world. That's a lot of per person, per capita emissions. But if we can stay down here in this lower trajectory and have a more efficient urbanization and less emissions, that'll be clean air and less warming of the planet. So this is where Africa has a great opportunity. And I'll end by saying that, why don't we treat climate change and the global climate crisis like an infectious disease, like the emergency that COVID-19 is for us now. We should be treating climate change the same way, because after all, climate change is a global health crisis. So with that, I thank you very much for your time and attention. It's really an honor and a pleasure to be presenting in your 5th annual conference. And I hope you have a rest of the great conference. Thank you very much. And I'll just end the presentation. Take care. Oh, that's me. I just ended screening. And so now I'm going to end the presentation. So I'm Jonathan Patz from the University of Wisconsin. Thanks for your attention. Take care. Bye.